In the animal kingdom, pain is a vital signal. It warns of danger, alerting creatures to potential threats in their environment. This sensation is crucial as it protects us from further harm by prompting immediate action. But sometimes pain outstays its welcome, becoming a chronic issue that affects daily life. It lingers long after the initial threat has passed, turning into a persistent, unwelcome companion. This is where analgesic drugs, our silent guardians of comfort, step in to offer relief. Analgesics are a diverse group of medications, each designed to target different types of pain. They share a common goal to relieve pain and improve quality of life. They achieve this by targeting different parts of the pain pathway, from the site of injury to the brain itself, ensuring comprehensive pain management. Imagine a vast communication network where signals are constantly being transmitted. Just like data traveling through fiber optic cables, our nervous system transmits signals throughout the body. This is how our nervous system operates, with pain being just one type of signal among many. Pain is just one type of signal, but it can dominate our senses when it becomes chronic. Analgesics work by intercepting these pain signals, preventing them from reaching the brain. They disrupt the transmission of pain messages, effectively reducing the sensation of pain. Understanding how these medications work is crucial for effective pain management. It allows us to use them effectively, ensuring maximum benefit with minimal side effects. It also helps us minimize potential risks, making sure that we can manage pain safely and responsibly. NSAIDs, or non-steroidal anti-inflammatory drugs, are like skilled firefighters, rushing to the scene to control and extinguish the flames of pain and inflammation. They tackle pain at its source, inflammation, providing relief and allowing the body to heal more effectively. When we experience an injury or infection, our bodies release chemicals called prostaglandins, which play a key role in the inflammatory process. These chemicals are responsible for the redness, swelling, and pain associated with inflammation, signaling the body to start the healing process. NSAIDs work by blocking the production of prostaglandins, thereby reducing inflammation and alleviating pain. They inhibit the activity of enzymes called COX-1 and COX-2, which are crucial in the synthesis of prostaglandins. By reducing inflammation, NSAIDs effectively dampen the pain signals being sent to the brain, providing much-needed relief. Some common examples of NSAIDs include ibuprofen, also known as Advil or Motrin, which is widely used for its effectiveness. Another popular NSAID is naproxen, which you might know as Aleve, often chosen for its longer-lasting effects. These medications are available over the counter, making them easily accessible for quick relief. Others, like celecoxib, marketed as Celebrex, require a prescription and are used for more specific conditions. While generally safe when used as directed, NSAIDs can have side effects that users should be aware of. These may include stomach upset, heartburn and discomfort, which can usually be managed with proper use. In some cases, more serious gastrointestinal problems can occur, especially with long-term use, so it's important to follow medical advice and use these medications responsibly. Acetaminophen, also known as paracetamol or Tylenol, is another widely used analgesic. Unlike NSAIDs, acetaminophen does not have significant anti-inflammatory effects. Its precise mechanism of action remains somewhat of a mystery. Scientists believe it works primarily in the central nervous system. It may block the production of prostaglandins in the brain and spinal cord. This reduces the perception of pain. Acetaminophen is generally considered safer than NSAIDs in terms of gastrointestinal side effects. However, it can cause liver damage in high doses or with prolonged use. Opioids are powerful analgesics. They are reserved for moderate to severe pain. They work by binding to opioid receptors in the brain, spinal cord, and other parts of the body. These receptors are part of the body's natural pain relief system. When opioids bind to these receptors, they block pain signals and also trigger the release of endorphins, the body's natural feel-good chemicals. Morphine, codeine, and oxycodone are examples of opioids. They are highly effective in managing pain, but also carry a significant risk of side effects and addiction. Opioids can cause drowsiness, constipation, and respiratory depression, which can be life-threatening. The use of opioids requires careful monitoring by a healthcare professional. Section 5. Topical analgesics, soothing pain at the surface. Topical analgesics are applied directly to the skin. They provide localized pain relief. They work in different ways depending on their ingredients. Lidocaine, for example, is a local anesthetic. It numbs the area by blocking nerve signals. Capsaicin, on the other hand, is derived from chili peppers. It produces a warming sensation that overrides pain signals. Topical analgesics are often used for musculoskeletal pain, such as sprains, strains, and arthritis. They can also be helpful for nerve pain, like shingles. Because they're applied directly to the affected area, topical analgesics generally have fewer systemic side effects compared to oral analgesics. Section 6. Choosing the right analgesic, a matter of matching needs and risks. Selecting the appropriate analgesic involves careful consideration. Factors such as the type and severity of pain, individual patient characteristics, and potential side effects must all be taken into account. For mild to moderate pain, NSAIDs or acetaminophen are often the first line of treatment. For more severe pain, opioids may be necessary, but their use should be carefully monitored. Topical analgesics can be a valuable addition to oral medications, particularly for localized pain. It is important to remember that all medications have potential risks and benefits. Section 7. Understanding pain signals, a journey through the nervous system. To fully grasp how analgesics work, we must first understand how pain signals travel through the body. Pain is a complex process that involves multiple steps and various parts of the nervous system. Imagine a vast network of nerves connecting every part of our body to the brain. This intricate system allows us to feel sensations, including pain, and respond to them. When we experience an injury, specialized sensory receptors called nociceptors are activated. These receptors are sensitive to potentially harmful stimuli. These nociceptors are located in our skin, muscles, joints, and organs. They play a crucial role in detecting damage and initiating the pain response. Once activated, nociceptors send electrical impulses along nerve fibers to the spinal cord. This is the first step in the journey of a pain signal. The spinal cord acts as a relay station, transmitting these signals up to the brain. It ensures that the pain message is quickly and efficiently sent to the brain for further processing. In the brain, the thalamus receives the pain signals and directs them to different areas for processing. The thalamus is like a central hub, distributing information to the appropriate regions. The somatosensory cortex helps us identify the location and intensity of the pain. This area of the brain allows us to understand exactly where the pain is coming from and how severe it is, enabling us to react accordingly. Section 8. The importance of proper analgesic use, balancing relief with responsibility. Analgesics are powerful tools for managing pain. When used responsibly, they can significantly improve quality of life. However, it is crucial to use them appropriately and under the guidance of a healthcare professional. Misuse or overuse of analgesics can lead to adverse effects, tolerance, dependence, and even addiction. It is essential to follow the recommended dosage and duration of treatment. Patients should also be aware of potential drug interactions and report any pre-existing medical conditions or allergies to their doctor. Open communication with healthcare providers is paramount. Section 9. The future of pain management, exploring new frontiers. The field of pain management is constantly evolving. Researchers are continually searching for safer, more effective ways to alleviate pain. New discoveries in neuroscience and pharmacology are paving the way for innovative treatments. One promising area of research is the development of non-opioid analgesics that target specific pain pathways without the addictive potential of opioids. Gene therapy and stem cell therapy also hold potential for treating chronic pain conditions. Section 10. Conclusion: respecting the power of pain relief. Analgesics are essential tools in our quest to manage pain and improve quality of life. From the familiar over-the-counter remedies to powerful prescription medications, these drugs offer a lifeline for those suffering from acute or chronic pain. As we have explored, different classes of analgesics work through various mechanisms to interrupt the pain pathway and provide relief. Understanding these mechanisms empowers us to make informed decisions about pain management. However, it is vital to approach analgesic use with respect and caution. By using these medications responsibly in consultation with healthcare professionals, we can harness their power to alleviate suffering while minimizing potential risks.